Thank you, Mr. Speaker. The first thing that needs to be said in this debate is that its title gives a false impression. Mismanagement creates an impression that the government has been doing its best to manage the NHS well, but has failed to do so, when in fact the emergency in our NHS is the result of 13 years of deliberate policy decision by the party opposite. A staff shortage of 133,000 that has only grown in recent years is not mismanagement. A shortage of over 40,000 NHS nurses is not mismanagement, especially not when the government knew there was a huge shortfall and decided anyway to end the nurses' bursary and make already underpaid nurses pay a fortune to train whilst inflicting annual real terms pay cuts on staff across the NHS. Consistently allowing staffing numbers to remain far below safe levels is a decision, not something that was just badly managed, as was the intentional fragmentation of the NHS in 2012 to end statutory responsibility to provide a safe and fit health service. Cutting thousands of beds and millions of annual bed days in the NHS is a wrecking strategy, even more clearly so when it continued during the pandemic, part of an ideological push toward a rationed system that is more profitable for private providers and in which the NHS is not in perpetual crisis because of demand, but because bed staff, hospitals and services have been intentionally slashed below demand that was already there. Even the current push to so-called integrated care system is acknowledged by the King's Fund and others to be in reality based on a US accountable care system that is designed to withhold treatment in order to cut costs and share the profits with private providers. It's vital to be clear that the NHS is not merely collapsing, it's in a state of induced coma. There is not enough time in this debate to properly list all the damage Conservative governments have done to our health service in the last 13 years, and all done in the full knowledge of what the consequences would be for those who need the NHS and for those who work in it, and the deaths that it would cause. The scale of this intentional damage is so great that playing around the edges with a little more cash that will end up in private company accounts, let alone talk of one-off payments to NHS staff who now rely on food banks, is just PR. The solution to all this is not better management. The only solution to 13 years of fragmentation and hollowing out is a return to the NHS original principles, a publicly funded, publicly owned national healthcare service free to all.
Order.
Thank you.